Hi, I'm Dr. Rohit Arora. I'm a pediatrician and neonatologist at Cloudnine Hospital, Golf Course Road, Gurugram. The motion frequency in newborn is actually quite variable. Newborn babies, because of the exaggerated gastrocolic reflex, they can pass motion after every feeds, and that's pretty normal. But sometimes newborns may not pass motion for, let's say, even days together, and that's also normal. So as long as babies are otherwise healthy, peeing well, feeding well, sleeping all right, so the stool frequency may be normal and it can be very variable at different ages. Similarly, vomiting, some spit-ups are expected after feeds and they may be absolutely normal. So if the baby is otherwise healthy, we may not label them as diarrhea or vomiting. They can be just normal spit-ups and normal motion pattern. Now in situations such as when they are associated with fever, when there is other viral symptoms, they are not feeding well, they are not sleeping well, their pee count reduces, then maybe the diarrhea and vomiting, they are significant. So they can be caused by some kind of infection, there can be viral diarrheas, which are probably the most common, or sometimes there can be bacterial diarrheas as well when there is some blood or mucus in the stools, right? So when there is blood, it's probably pointed more towards bacterial than the viral infection. Then sometimes it's an allergic manifestation towards the certain formula which the baby is getting. Baby's intestine might not be liking that formula, it's not tolerating, and therefore babies develop some loose stools. Also, sometimes if the babies are on certain drugs like antibiotics, more commonly amoxicillin and clavulanic acid combination, such babies may develop loose stools as well. So you need to figure out as to what is the cause of these loose motions and manage accordingly. If it's antibiotic, once you stop it, the motions generally also improve. If it's the formula related, again, if you just stop the formula, it improves. If it's infection related, then you just have to wait it out for certain days in terms of viral. And if it's bacterial, you might want to give certain antibiotics. So you just manage the symptoms. Just make sure babies don't get dehydrated. Continue with the breastfeeding, don't stop that. Maybe keep a count of the number of urine babies passing. Give fluids such as ORS to the babies. If the baby is big enough, more than 6 months, you can give coconut water, you can give buttermilk. All these natural rehydrating solutions can be given. Just ensure that the parents keep a pee count. That will tell us the status of dehydration in such babies and will help us improving upon the stools. So viral diarrheas will subside on their own without the need of antibiotics, and it's a self-limiting course, and just reassurance and fluid management is all what is required. Sometimes you need to give probiotics as well. So certain probiotics containing enterobacterus cloacae, bifidobacterium and other good bacteria, they can be prescribed as well.